power of a dream. Driven by vision to save life of every single pregnant and neonate. And commitment towards set objectives takes one's efforts step by step towards success. To reduce the maternal and neonatal mortality rate, it was realized that the quality aspects of health services will ensure a sharper decrease in maternal and neonatal mortality rate, and thereby would help India achieve the Sustainable Development Goals.
इनके अंदर सारे ही पैरामीटर पे काम लगातार पिछले 3-4-5 साल से हुआ है.
We have exclusively worked to improve quality aspects of health services in last 4-5 years.
उनके स्टाफ को
In maternal health services, government and private ratio is around 75% and 25%.
75 और 25 का रहता है.
Only if quality improves both in government and private sector, IMR and MMR of Rajasthan will improve.
So the challenge was to involve and handhold the private hospitals to improve their quality of services and thus considerably reduce IMR and MMR. World's 3 public health organizations with decades of experience decided to join hands to pilot world's first impact bond in the health sector through a blended finance mechanism for improving the quality of services in private hospitals.
While revealing the data and while analyzing the global scenario of maternal and neonatal morbidity and mortality, we realized that the quality has a much more role to play in bringing down the maternal and infant mortality and morbidity across the globe.
Rajasthan has achieved around 4-fold increase in institutional deliveries in the last 2 decades. But in the same period, IMR and MMR of the state has decreased only by around half. Hence, Rajasthan was considered for piloting and also supplementing the state's efforts in improving IMR and MMR. Government of India recognizes importance of private health sector in reaching out to a larger population with quality services. Both flagship health programs, Janani Suraksha Yojana and Pradhan Mantri Jan Arogya Yojana, have been implemented in private facilities as well. Learning from these experiences, Palladium designed Utkrish Development Impact Bond for private small healthcare organizations of Rajasthan, with an objective of impacting 600,000 lives of mothers and children in the next 5 years. The objective was to improve the quality of services in 360 small healthcare organizations by preparing them to achieve quality in health services. The 2 prestigious accreditations for quality of health services, NABH, led by Quality Council of India, and Manyata certification, led by Federation of Obstetric and Gynecological Societies of India, were decided to be achieved in the project period.
So this is the unique combination across the country, and rather I would say across the globe, where a single hospital has 2 different quality assurance certification or accreditation.
USAID and MSD for Mothers decided to support this innovative project for improving the quality of health services as an outcome funder, with UBS Optimus joining as the investor.
There, the USAID-like organization comes in, where we take up a new model, test it whether it works or not, and then if it works, then we advocate with the government. So in this case, more than the outcome funding, what was really inspiring for us is this new model of private sector putting in their private capital for development, and agencies like USAID and maybe later government comes in and pays only if the outcomes are achieved.
MSD for Mothers is MSD's global initiative to help create a world where no woman has to die giving life. And we like to contribute our scientific and business expertise as well as our financial resources.
DIB model mandates release of funds based on verification of prefixed measurable outcome by independent verification agency. A typical DIB model of social funding has 6 stakeholders, with public welfare at its center. With these dynamically placed stakeholders, world's first DIB model funding in the health sector was launched in Jaipur on 23rd April 2018. One of the major challenges for the project was to take hospital management on board.
2017-2018 के आसपास
Around 2017-2018, Utkrish team met us, and when we started working with them, we felt confident that yes, we can get NABH.
NABH में क्यों नहीं जाएं?
The process started with mapping of small healthcare organizations of Rajasthan. Orientation meetings resulted in signing of MOUs with around 516 hospitals in phases. Baseline and gap analysis of each network hospitals was shared with them.
सभी स्टैंडर्ड्स में
We
हमारा
scored less than 25% in most of the parameters, and we were worried about it.
जो इसको हम कैसे इम्प्रूव कर सकते हैं?
The key interventions under Utkrisht are improvement of infrastructure and facilities to ensure patient safety and rights, ensuring required safety mechanism with proper signages, and also training of staff to manage any contingencies, better management of OT and labor room for safe and infection-less births and to meet any emergency, improved services of laboratories, pharmacies and indoor patient dispensaries, antenatal care and postnatal care for proper counselling of mothers and caregivers, proper documentation and record keeping, and overall, patient-friendly behavior of the staff.
एक्सपीरियंस बहुत अच्छा
I
था।
came here for delivery. All staff and doctors were very good to me. I'm satisfied.
बहुत अच्छा है।
ऐसा है
I'm patient auntie and I'm allowed inside the labor room. This is quite reassuring for patients.
तसल्ली होती है।
Behind these visible improvements, there was a well-executed, collaborative approach of hospital authorities, enthusiastic and friendly staff at all levels, and a proactive Utkrish team.
इन लोगों ने हमारे पूरे स्टाफ
These people trained us how to manage patients, as time is very critical in saving life. But now, within 10 to 15 minutes, the patients are being managed by the nursing staff. A web-based PMIS and user-friendly dashboard was developed, ensuring quality data inputs on daily basis and proactive monitoring of the same in weekly meeting were the pivotal. As the project interventions and training were in full swing, COVID pandemic disrupted the Utkrisht activities too. Support to its network hospitals by Utkrisht during COVID-19 was a call beyond the project obligations.
देखिए जैसे कि आपको पता है अभी कोविड
Various channels of communication were used to reach out to the hospitals. The on-site training approach was adapted to online mode quickly, and innovative tools were developed. WhatsApp groups were formed for sharing interactive training tools to revise and for peer learning. Increased risk of COVID infection necessitated touchless services. Telecounseling cum telemedicine services to the mothers enrolled at Utkrisht network hospitals was started.
आपका नंबर में राजीव हॉस्पिटल झुंझुनू से प्राप्त हुआ मैडम।
Today, with 421 SHCOs under the project, Utkrisht is reaching out to 15,026 hospital beds across Rajasthan and has been able to create an impact by ensuring quality health services to 225,583 deliveries with the buzz generated around Utkrisht DIB. All stakeholders feel that such initiatives would go a long way in improving the quality of health services, improving patient satisfaction levels, and ultimately helping India to achieve sustainable development goals.